This is Channels Television's breaking news.
Did you know that interactions with puppies and kittens could expose children to a parasite that silently affects their health and development? Toxocariasis is a neglected but highly prevalent parasitic infection caused most commonly by Toxocariasis or roundworms. Although many infections cause asymptomatic or mild symptoms, serious cases can lead to severe organ damage, specifically visceral, ocular, or neurological impairment. Children often become infected through accidental ingestion of soil, sand, or even fur contaminated with feces from dogs or cats. It is more likely for stray puppies or kittens to carry the Toxocara eggs, making contact a key risk factor in the spread of this infection to humans. It is also present in raw or undercooked meat from potential parasitic hosts. Toxocara eggs that have been shed into the environment can last for years in dirt or sand before being ingested by an animal or child. After ingestion of the eggs, larvae hatch in the duodenum of the small intestine, penetrating enteric lining and migrating through portal veins, transferring blood from the gastrointestinal tract to the liver. The larvae then pass through the liver and enter pulmonary circulation, which allows for migration into the lungs. Transportation throughout the body is then achieved through re-entry into the circulation system. Such migration can occur to the posterior segment of the eye, inducing ocular toxocariasis (OT), a compartmentalized syndrome caused by this infection. An infection of your child's retina may primarily show no signs. However, with onset over a period of days to weeks, parents will notice their child developing redness, inflammation, a white pupil, and a unilateral loss of vision. It is also important to note that the parasite can form small masses granulomas appearing in the periphery, macula or optic disc, causing traction or retinal folds affecting sight. If the infection is left untreated, complications that can occur include cataracts, retinal detachment, scarring, or even a shrunken or permanently non-functional eye. It is important to note that toxocariasis is often mistaken for retinoblastoma, specific ocular ascaris lumbricoides, or cytomegalovirus due to similar eye redness, inflammation, and visual impairments. Toxocariasis is suspected if a child presents with unilateral loss of vision or notice of squinting. It is definitively diagnosed through the examination of Toxocara larvae in histological sections of the affected tissue. However, due to the inability of a retinal biopsy, the test is rarely performed, and mobile larva or larva tract can be directly observed in the retina for patients suffering from OT. Immunological testing can also be performed indirectly to diagnose the infection through the determination of antibody defense against the Toxocara using the ELISA. Treatment includes antiparasitic or anti-worm medications such as albendazole or mebendazole, and for ocular cases, specialized eye care. Ocular inflammation must be controlled with topical and systemic corticosteroids. Preventing toxocariasis before infection is relatively simple. Wash your hands after playing with pets and before eating. Clean up animal feces properly. Ensure that puppies and kittens you interact with are tested and treated for worms regularly. And above all else, make sure your children understand the dangers of ingesting things that are inedible, such as soil or sand. Recent studies have shown that over 90,000 disability-adjusted life years have been lost from toxocariasis, with more than 50% in relation to cognitive impairment in children. Moreover, a 2024 serotyping study in Brazil found that about 11.5% of sampled children were found to be seropositive for the Toxocara antibody, a similar percentage from the same study performed in 2008. Therefore, exposure to this infection continues to be an ongoing public health concern with no signs of decline or reduction. Although toxocariasis may be seen as a silent infection, its impact is real and damaging. Awareness is the first step in preventing infection in your family and community.